When the call first came out from HealthCareCAN, this was a new award, and it spoke Patrick McGrath. It was as if it was written talking about him. He is a leader. He is a leader to us here within our institution, within the province, within the country.
He's a leader of purpose and passion that is really committed to taking on challenges and opportunities that create long-lasting change and transformation in the healthcare system.
He's a transformational leader who's very focused on who we are serving, how we do that, and gives of himself in terms of helping others create the very best of their own abilities and mentors that in a way that brings the very best to the people we serve.
I've received an awful lot of recognition for my work. I think that I've had more recognition than I deserve, and that's because of the excellent people that are around me. It's a team sport in health in particular. You can't be a solo leader. You have to have a team, and you have to build your team, and you have to trust your team. And that takes, you have to select people right when you have the choice, but sometimes you don't have the choice, and then you have to nurture them. And you nurture them the same way as we nurture families. We nurture them with positive feedback, encouragement, and at the same time, very high standards.
I'm Dr. Patricia Lingley-Potty.
And I'm Dr. Patrick McGrath. We're from Halifax, Nova Scotia.
And our innovation is the Strongest Families Institute. Strongest Families is a distance education system of care, providing families with help to overcome problems like child behavior difficulties.
Between 40 and 60% of families pull out of therapy before they're finished. And it's not because they're not motivated, it's because the system is not designed to make it easy for them to participate.
So the work that Patrick has done with the Strongest Families and how we bring support to children and their families when they're dealing with a mental health issue to their home, directly to their home, through the use of technology, through a different way of meeting their needs, that has made an impact in this province, across Canada, in Finland, in Vietnam. He's really making a mark on how we use creative and innovative ways to meet needs in the world.
I was in a meeting and somebody from Newfoundland came up, a small town in Newfoundland, and they said, well, they were talking to their hairdresser and they were asking how it was going. And in small town Newfoundland, everybody knows everybody. And the woman said, my life was given back to me by this program that started in Halifax called Strongest Families. And she went on to account how her child, who was having severe behavior problems, really, they just changed dramatically because of that. How can you not feel joy when somebody tells you that?
I think that's just a perfect example of where he's innovated on design, he's researched different ways to deliver healthcare, and along the way as he's done that, what you really see coming through with Strongest Families is his passion and compassion really around the human connection. So though it's a broad-based, internationally based program now, it's also a program that at the heart of it reaches individual families every day and makes a difference.
In Nova Scotia Health Authority and the IWK, he has developed work with the foundations, the two largest foundations, to support what he named the TRIC grants, translating research into practice, and really engaging others, but engaging fundraisers in a way that they can contribute to research and support researchers to bring their very best work to the care environment.
I think we need to invest more in research. I do think that we haven't invested in research, and more importantly, we haven't regarded research as a way of delivering better health care. And I think that historically, there's been research here and healthcare here, and sometimes they touch. And really what I've tried to do here in Nova Scotia is I've tried to integrate these much more so that research actually changes healthcare.
He insisted that we have administrators, researchers, clinicians, all at the table working together. And so I think that's just a really nice example of where his leadership comes from a place of partnership and collaboration. And he really models the importance of working alongside.
And he gets them to start questioning whether or not there is an opportunity to use research or to look at a new innovation in a way that might help them look at their delivery of healthcare differently. And it's working.
He is a builder and a coalition builder, and that's a powerful legacy to bring around the people of Canada.
Whether it's founding and leading the clinical psychology program here at Dalhousie, or innovating on the field of pediatric pain research, bringing research into practice. There's just so many examples throughout his career where he's left a long-lasting mark of contribution as a leader.
My goal has always been to help kids in particular. And so I check out everything against that goal. Is developing this going to help? Is developing that? Because I know it's a very selfish goal, because that makes me feel good. There's nothing more rewarding in general, in my view, than helping somebody else. When you help somebody, that gives more to you than it does to them.